Hello, I'm Dr. Marshall here at Medical Specialty Clinic, and today I'd like to take a minute and talk to you about chromium supplements. So chromium is a naturally occurring element and it is an essential part of our diet. We typically get chromium from foods such as broccoli, potatoes, green beans, whole grains, beef and poultry. Some fruits such as apples and bananas, milk and dairy products also have it. So the reason chromium is important is it is a cofactor in our metabolism and how we use insulin and metabolize sugar or glucose. So I recommend chromium quite a bit for diabetic patients. Some studies have shown that chromium can help lower blood sugar and also improve insulin sensitivity, which is the problem with type 2 diabetes, is we become resistant to insulin. Our insulin does not work like it's supposed to, and our sugar starts to creep up. So that process actually takes place for many times years before your physician will actually say you have diabetes, because the insulin resistance is hidden at first and it takes time to build up until it gets to the point where you have difficulty keeping your blood sugar normal. So by the time your blood sugar gets above the normal range, it's been building for quite a while. So that is a problem in diabetes. So if we can reverse that insulin sensitivity, then in a lot of ways that's the main treatment for type 2 diabetes. So diet is always the foundation, so improving the amount of sugar and carbohydrates that we take in. The quality of carbohydrates also makes a big difference. So complex carbs from vegetables are going to be much better than simple carbs from sugar, candy, even some fruits, and then some carbs, complex carbs are not as good. So, obviously potatoes and French fries, things like that can be hard on your insulin levels. So improving that with diet is always the first step, and then obviously there's prescription medications. As physicians, we typically start off with things like metformin, and then there's many other medications, but all prescription medications have some side effects and some problems. So if you can get by without medications, that's generally always better. Although, again, just a little disclaimer, this is not medical advice. This is not to be construed as a doctor-patient relationship. So this is just for informational purposes. Please discuss this in more detail with your provider if you have questions about it. So chromium, I have, this is just one example that I found on Amazon. This is 200 micrograms. It says on the bottle that it is an insulin cofactor, just as a sales point. So this is a pretty good product. This is 200 micrograms. So typically you would take this once or twice a day as a starting dose, up to 1,000 micrograms a day total, and you would usually split that into 500 micrograms twice a day, but 200 micrograms once a day would be a good place to start, and you could always increase that to twice a day, or 2 of these capsules twice a day would get you up to 800. That would be a pretty good dose. I wouldn't go more than 1,000 micrograms a day. Chromium is considered a safe supplement in most cases, but as always, discuss this with your healthcare provider. If you have other medical problems, take other prescription medications, things like that. So just a little quick note on chromium. This can be a real benefit to patients who are struggling to keep their blood sugar under control. So I hope that helps, and I look forward to seeing you in the next one.